Assalamu alaikum. My name is Dr. Sidra. I'm a resident physician of ENT Head and Neck Department at Civil Hospital, Karachi. Today, my topic of discussion is the physiology of the ear. Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. The ear, we all know, are the paired structure present on either side of the skull found in all animals, including humans. So, why are we learning the physiology of the ear? As a medical physician, we deal with the different diseases caused by different pathologies. If we know the normal anatomy and physiology of the organ, it will help us in identifying and distinguishing disease from a non-disease organ, and it also helps us in understanding the pathophysiology of the disease. So, at the end of this lecture, you should be able to define and explain some basic terminologies of audiology, and you will be able to enlist some components and functions of auditory and vestibular system. Sounds are produced by the vibratory objects. The vibration of the objects causes the surrounding air molecules to move back and forth, creating an alternate regions of high and low pressure. Thus, a sound wave is a pressure wave. It propagates in the form of fluctuations in air pressure. The loudness is determined by the amplitude of the sound wave, which represents the strength of vibration produced by the sound source. The stronger the vibration of the sound source, the greater the amplitude of the sound wave, the louder the sound will be. The pitch is related to the frequency of the sound source. The sound source, which represents how fast a sound source vibrates. The faster the sound source vibrates, the higher the frequency will be, the higher the pitch will be produced. The amplitude of the sound or loudness of the sounds is measured in decibel, while the frequency is measured in hertz. A normal human ears can detect in range of between 20 to 20 kilohertz, while some animal species can hear beyond this range. In older individuals, there is often high frequency hearing loss between above the 15 to 16 kilohertz. This condition is known as presbycusis. This makes them harder to understand against the ambient noise. So, what are the functions of the ear? We all have ears. So, hearing and the balance. There are two systems which are operated by our ears and are responsible for each function: auditory system and the vestibular system. The auditory system is related to the sense of hearing, in which the mechanical energy of the sound is converted into the electrical impulses of the nerve, which is transmitted via a cochlear nerve to the brain and interpreted by the brain as sound. Any dysfunction in this system leads to deafness. The vestibular system is related to the sense of equilibrium, which converts the mechanical energy of the linear and angular acceleration to the electrical impulses and transmitted via vestibular nerve to the various regions of the brain. Any dysfunction in this leads to vertigo, imbalance, and motion sickness. The human ear is divided into three distinct regions: outer, middle, and inner, anatomically. I won't go into the detail of anatomy of the ear, but this is worth noticing here. The outer and the middle ear helps us in the conduction of the sound waves. The inner ear helps us in transduction of the sound wave. We're going to study the functions of each part one by one. The outer ear comprises of pinna and the external auditory canal. The pinna is the most prominent part of the ear. It helps us in collection of sound waves and funnels them through the external auditory canal to the tympanic membrane. Other than this, it helps us in localization of those sound waves by the method of head shadow, because sound waves coming from a sound source never reaches the two pinna at the same time. So there will always be their difference of intensity and the time between those pinnas, between our two pinnas. So by calculating the intraoral difference of intensity and the time, we can localize the sound source. External auditory canal has two functions, acoustic and non-acoustic. Acoustic function is related to the transfer of acoustic signals through the external auditory canal to the tympanic membrane, and it also acts as a resonance chamber for the certain range of frequencies between 5 to 7 kHz. Thus, it helps in amplification of the sound waves. The non-acoustic function is related to the structure of external auditory canal. The outer one-third of external auditory canal is lined by skin. It is highly innervated and vascular. It contains a specialized apocrine gland which secretes cerumen, which traps the small insects plus dust particles, and it acts as the posterior side of the middle ear. The sound waves coming from the external auditory canal hits the tympanic membrane. It causes it to vibrate back and forth. This vibration transfers through the ossicular chain to the inner ear by the foot plate of the stapes. The middle ear transfers the acoustic energy from medium of air, which is a medium of high velocity, low resistance, to the medium of fluid, which is a medium of low velocity, high resistance. So it is organized and structured in such a way to combat this resistance. This is known as impedance matching system. It occurs due to following factors: the aerial ratio of the tympanic membrane to the foot plate of the stapes, the lever action of ossicles, the phasal difference between the oval and the round window. We're going to study them one by one. The area ratio tympanic membrane to the foot plate is the area of the tympanic membrane is much larger than the area of the foot plate of stapes. Thus, the sound that receives at the foot plate of the stapes is much greater than the sound that arrives at the tympanic membrane. It increases the transformation ratio by the 17 times. The other factor is the lever action of the medius and the incus. The handle of medius is much longer than the long process of increase. Thus, it provides some movement of arm and the mechanical advantage to the middle ear. It increases the transformation ratio by 1.3. Thus, the total transformation ratio of the middle ear is 17 into 1.3, which is equivalent to 22. The other factor for middle ear magnifying effect is the phasal difference between the oval and the round window. You can see in this diagram there is inward movement of the tympanic membrane plus the oval window, but there is outward movement of the round window. Thus, in the normal ear, no sound wave reaches the oval and the round window at the same time. Due to presence of tympanic membrane in the middle ear cushions, so there will always be a phasal difference between the oval and the round window. In the presence of large perforation of the tympanic membrane, there will be a loss of this phasal difference. Sound reaching the oval and round window at, with the same phase, they will cancel each other, and there will be the paralymphasis and the deafness. This is another diagram showing the inward push of the oval window and the round window pushing out. And this is also showing the traveling waves in the direction of the traveling waves. We have studied the significance of particular change in the transformation of sound waves through the middle ear. Thus, any pathology or discontinuity of the middle ear ossicles can lead to significant deafness. This is worth noticing here that intact tympanic membrane with ossicular discontinuity lead to more deafness as compared to the tympanic membrane perforated with ossicular discontinuity. Yes, the intact tympanic membrane acts as a barrier for the transformation of the sound waves, but in the perforated eardrum, the sound waves can directly hit the oval and the round window, can produce some vibration in the oval window. The other structures of the middle ears include two muscles and eustachian tube. Two muscles are tensor tympani and the stapedius, which mediate the acoustic reflex, which is the reflexive contraction of the middle ear muscles in response to loud sound. They stiffens the ossicles and decreases the transformation ratio of the middle ear, thus it protects the inner ear from the loud sounds by damping the loud sound. Eustachian tube is another structure of the middle ear. It connects the middle ear to the nasopharynx. It provides route to the drainage of the fluid and also equilibrates the ear pressure during swallowing and yawning. There are few critical cases I put here. So So if you want to guess, you can pause the video. If a patient comes to you with a complaint of hypersensitivity to the sound or excessive loudness or pain, what might be he experiencing, and what is the cause of this condition here? I have already given the hint. It is most commonly caused by prolonged noise exposure. Sometimes it is caused by stapes hypermobility. Stapes is provided by stapedius, which is innervated by the facial nerve 7. Any lesion of the facial nerve 7 can lead to the stapedius paralysis, such as Bell's palsy, Lyme's disease, or Ramsay-Hunt syndrome. And this condition of hypersensitivity to the sound or excessive loudness is known as hyperacusis. Case number 2 is a 5-year-old boy is brought to you with a complaint of nasal obstruction, snoring, inattentiveness in class, and performance issues for 1 year. What might be he experiencing, and what is the cause of this condition in this patient? You can pause it. You perform the X-ray soft tissue, head and neck laterally, and you found out that there is adenoid enlargement. Due to adenoid enlargement, there is a mechanical obstruction of the eustachian tube, thus it does not function properly, led to collection of fluid behind the tympanic membrane. And you perform otoscopy, you find this. And this condition is otitis media with effusion. Case number 3 is an infant is brought to you with a complaint of irritable crying, fever, vomiting, diarrhea, pulling on the ears, falling a cold, and you found an otoscopy red bulging DM. So, what is the diagnosis? And what is the cause of this condition in this patient? This is acute otitis media due to following an upper respiratory tract infection, which led to the inflammation of the mucosa of the eustachian tube and the trapping and collection of the fluid behind the tympanic membrane. And the infection of those trapped fluids led to the acute otitis media. In infants, the eustachian tube is more shorter and horizontal. The infection of eustachian tube is most common as compared to adults. It comprises of 3 main structures: cochlea, which is related to the sense of hearing, semicircular canal, and 2 otolithic organs, which are related to the sense of equilibrium. The cochlea is a system of 3 coiled tubes through its length: scala vestibular, scala media, and scala tympani. The middle tube is known as cochlear duct. It is separated from the scala vestibular and the scala tympani by resinor and the basilar membrane, respectively. It contains It contains endolin, which is rich in potassium, and it helps in the building the endocochlear potential. And scala vestibula is filled with perilymph, and it connects at its larger end to the oval window. Scala tympani is also filled with perilymph and connects at its larger end to the round window. Cochlear duct is where the mechanical transduction takes place. Organocorti are located on the basilar membrane. There are four rows of hair cells connected to the nerve and at its basal sides. When the foot plate of the piece push against the fluid of the inner ear causes the formation of the trapline webs. These trapline webs causes the basilar membrane and the hair cells attached to them to move up and down, causes the cilia of the hair cells to bend on itself, and thus production of action potential takes place. By opening the mechanically gated potassium channel, it depolarizes the hair cells and causes the nerve to stimulate and send signals to the brain. You will see in this diagram that the cochlear duct is distended with endolin, pushing the regional membrane into scala vestibula and impairing the mechanism of hearing. This condition is endolymphatic hydro, which commonly occurs in meniastasis. Some chemicals are directly toxic to the hair cells of the inner ear, can lead to permanent hearing loss. So we must know these part these chemicals. So there was a mnemonic, so you can memorize those. The loop and snake, my play Christian Queen. Loop for loop diuretics, S for salicylates, N for insects, A for antibiotics, G for aminoglycoside, Ma for vancomycin. Late for cisplatin, Christian for vincristine, Queen for quinine, which is an anti-malarial drug. And how do we differentiate sound? Our ability to differentiate sounds of different loudness and pitches is depend upon our ability of basilar membrane to respond differently to the different amplitudes and frequencies. Louder sounds causes more hair cells to move and generate greater nerve signals to the brain. How the ability of the basilar membrane to respond differently to the different frequency is related to the structure of the basilar membrane. The basal end of the basilar membrane is narrower and stiffer as compared to the apical end, which is wider and flexible. Thus, the high frequency sounds are high energy. They they stimulate the part which is the basal end of the basilar membrane, or the low frequency sound can travel farther down. Thus, the high-pitched sounds excite nerve fibers that are closer to the oval window, while the low-pitched sounds send signals through the fibers at the farther end. To sum up, sounds coming from the ear Funnels to the external auditory canal his the tympanic membrane, transfer through the ossicular chain to the foot plate of stapes, which pushes against the fluid of the inner ear, causes the formation of traveling waves, and these waves are transformed into the nerve impulses. Deafness can be either conductive hearing loss and defect in any of the sound conducting structures such as external or the middle ear, or the sensorineural hearing loss, a lesion of the inner ear or vestibulocochlear nerve. The Weber and the Rennie tuning fork test are used to differentiate conductive hearing loss from the sensorineural hearing.